Hi everyone, welcome back. Our discussion today will be on the NEET PG questions in the topic of clubfoot. I would recommend you to read the first part and the second part of my talks on clubfoot in the following YouTube channel. Now coming to the first question, which joints constitute the mid-tarsal joint? So the mid-tarsal joint is the combination of talonavicular and calcaneocuboid joint. So the answer is talonavicular and calcaneocuboid joint. Anything behind this mid-tarsal joint is the hindfoot. The second question, inversion or varus and eversion or valgus occurs in which joint? Yes, the answer is subtalar joint. Subtalar because it is the joint which is present beneath the talus and it is between the talus and calcaneum. So inversion and eversion occurs in the subtalar joint. Next question. In what percentage of children is the clubfoot bilateral? As we all know, bilateral clubfoot is seen in 50% of children. And whenever there is clubfoot, always you have to examine for the presence of DDH or developmental dysplasia of the hip. And it is bilateral in 50% of children. Next question, which muscle is contracted in hindfoot varus deformity? So varus occurs in the subtalar joint and varus means the hindfoot is turned inwards towards the midline at the subtalar joint. And as given in the previous talks, you divide the ankle joint into 4 quadrants and varus is the posteromedial quadrant and the important muscle causing varus is tibialis posterior. So the answer is tibialis posterior. Next question. What is the method of treatment of clubfoot? Yes, the treatment is serial manipulation and casting with the above knee cast from groin to the toes, and the name for this method of treatment is Ponseti's method, and the answer is Ponseti method. Next question, what is the sequence of manipulation in correcting the deformities of clubfoot? And as discussed in the previous video, the sequence is CAVE, C-A-V-E. C for cavus, A for adduction, V for varus and E for equinus. So the answer is CAVE. Next question, what will happen if the correction of clubfoot is not done in the sequence of CAVE? Yes, if the correction is not done sequentially, it will result in this type of deformity of the foot, which is called as rocker bottom foot, which occurs because of mid-foot break. So to prevent rocker bottom foot from occurring, the deformities of clubfoot should be corrected in a sequential manner of cavus, adduction, varus and finally equinus. So the answer is rocker bottom foot. Which tendon needs lengthening in Ponseti method in majority of cases? In majority of the cases, the cavus, adduction and varus can easily be corrected by manipulation and casting, whereas equinus tends to persist, and the important muscle causing this equinus deformity is the tendoachillis, and this tendoachillis needs lengthening in majority of cases of Ponseti method. So the answer is tendo-Achilles as given in this picture. In cases which are resistant to serial manipulation and casting, what surgery is done for clubfoot? And the magic word is yes, PMSTR, or in other words, posteromedial soft tissue release. You release all the soft tissues present in the posteromedial quadrant, which includes the tibialis posterior, flexor digitorum longus, flexor hallucis longus, tendo-Achilles. So these are the 4 tendons along with other soft tissues like the capsules and the ligaments on the posteromedial aspect of the ankle joint, subtalar joint and midtarsal joint. So the surgery name is posteromedial soft tissue release, and the soft tissue includes muscles, ligaments and capsule. What orthotic is used after achieving complete correction of all the deformities in clubfoot, either surgical or by casting? So once we achieve the correction, we put the child on this orthotic, and this is called as Dennis Brown shoes. When both the shoes are connected by a rod underneath, as given in the first picture, it is called Dennis Brown splint, and this is worn by the child until it starts walking. And once the child starts walking, you remove off the rod underneath and the child is wearing the Dennis Brown shoes alone, which is given on the right hand side of the picture. So these are the questions which might be asked for your NEET PG entrance exam in the topic of clubfoot, and this completes our day's discussion. Thank you, and don't forget to like, subscribe and share this video. Thank you.